So where is all of this headed in the Senate? Here to make their case, liberal blogger Faiz Shakir. He's a research director and editor of thinkprogress.org at the Center for American Progress. Also, conservative blogger Liz Mair, who blogs at lizmair.com. She's also the former online communications director for the Republican National Committee. Liz, let's start with you. I mentioned the proposal by John McCain today to strip away the Medicare cuts that are in the Democratic legislation. But during the presidential campaign, John McCain, as part of his health care proposal, proposed cuts to Medicare, and an independent group said it would be over $1 trillion in cuts. Isn't this the very sort of thing you say one thing during a presidential campaign, you see another thing on the floor of the Senate that essentially causes credibility problems for conservatives and Republicans?
Well, I think you could make the same case with regard to a lot of Democrats, though, because I definitely remember during the course of last year's presidential campaign, and of course I was working on that we did see attacks coming from liberals regarding proposals to reform Medicare. And so now you've got a situation where, people who previously opposed any sort of changes to Medicare funding are also coming out and advocating for pretty steep cuts. So I think that cuts both ways. That's politics.
Well, that is politics. And again, Faiz, to the point, John McCain's amendment is not expected to pass. Democrats are still going to have to do this largely on their own. So isn't this essentially having the desired effect that Republicans want? Even if McCain's amendment is not going to pass, even if people call it hypocrisy, it is still slowing down the process. And the longer this takes, the more it hurts the Democrats, right?
Well, I don't think it's going to take much longer. Hopefully we're going to get a vote here before Christmas. I think the most important news that we've had, David, is this Congressional Budget Office report, which showed that the large majority of Americans are going to see their premiums go down. And I think that, we've had months, David, where we've had to debunk one argument after another from Republicans, whether it was death panels, whether it was you lie being screamed at the president, concerns over the deficit, mammogram screenings, whatever it was, they've had to be debunked one after another. And the last remaining bullet I think the Republicans thought they had was that your costs are going to go up, your premiums are going to see an increase. And that has been knocked down. So I don't think that there are any reasons left to oppose health care reform at this point.
Well, Faiz, with that said, though, when you look at some of these numbers, at least from what the American people say they want of Congress, is it again back to what we discussed earlier about the Democrats maybe not selling and presenting some of these things, such as the information about premiums going down or staying the same, but especially the part about the premiums perhaps going down?
No, that's absolutely right, Tamara. I agree with you that there needs to be a better job of telling the story to the American public. This report just came out yesterday, so there's got to be some time here to explain this to the American public. I think that's one of the things you and I and some of the others are trying to do, is to get the facts out there. One thing I want to note, though, real quickly, is on the public health insurance option. For those who are critics of it, they should take a close look at the Congressional Budget Office report, because what it says is those who needed coverage the most are going to be able to afford it at a lower cost, and that it will bring down the cost for those who have private health care. So for those who are defenders of the private market, they should actually be defenders of the public health insurance option, because it solidifies it brings down costs for those who are in the private market.
Liz?
Well, we'll see. I mean, if they actually do succeed in getting a public option passed, and I highly doubt that they're going to, it seems to me pretty clear that a lot of moderate Democrats have just as big a problem with that, frankly, as a lot of Republicans do. We'll see. I think that it's all very well and good to talk about estimates and what may happen with costs. And incidentally, just to Faz's point that this will bring down costs for everybody, that's not actually what the report says in any way, shape, or form.
No, he's not saying it'll bring down costs for everybody. But let's be clear. The people who are going to see costs go up, that's roughly 1/10. Those are the people who have the best situation with health care,
it's 14 million
who have the independent
people.
plans, who are more willing to pay more for their health insurance, right?
In actual fact, the people who I think are most likely to be reliant on buying plans as individuals as opposed to getting it through their employers are the people who right now are probably most concerned about being priced out of the market. And the fact of the matter is you're talking about roughly 14 million people. Pretty much anybody who is in the market for independent insurance, who's going to have to buy it individually and who earns more than $45,000, who's going to see their costs, their premiums actually going up between,
Liz,
CBS says something from 10 to 13%.
Liz, in the individual market, people are first going to have an option now. They don't currently have an option. They're going to have presentable options, and people are going to actually get subsidies. And because they're going to receive some subsidies, they're going to actually afford a better quality health care plan than they currently have. That means that they're not going to be kicked out of their health care plan because they have pre-existing conditions. They're not going to face rescissions.
The numbers I just cited do not apply to people getting the subsidies. The numbers I just cited divided are people who are ineligible for the subsidies. So you're talking about 14
Liz,
million
still
people
only
who can
talking,
afford health care.
To be absolutely clear, when you talk about the people who the CBO says the cost will rise, you're talking about less than 10% of people who have insurance now. Everybody else, the CBO says their costs are going to drop under this legislation.
Actually, the CBO says that they may. It doesn't say that they will. It says that they could go down by about 3%.
Let's all be clear. Whenever Republicans or Democrats want to cite the CBO, it's not a statement of fact. It's just a CBO projection.
David, Chuck Grassley called the CBO God at one point.
That is true as well. Faiz Shakir, it's true that he called it God, not that it is. Faiz Shakir and Liz Mair, thank you both so much. We appreciate it.
Thank you.
Thank you.
Up next, David.